This video was created by Danny Kessler, Associate Professor and Korea's first PhD in wellness tourism. The global wellness industry promotes a specific model of physical recovery centered on ocean breezes, meditation, and green juice. These passive solutions are marketed as the answer to the massive trauma of oncology or robotic joint replacement. Modern medicine is physically invasive. Major surgery subjects the body to structural trauma and surgical shock, states that require an active mathematical intervention to resolve. Traditional recovery protocols often fail at the point of rest. Leaving the body to manage nerve compression and tissue shock in isolation allows inflammation to become a chronic state. The city of Daegu, South Korea, sits in a landlocked basin. Without coastal resorts or natural ocean air to rely on, Daegu could not follow the global trend of leisure-based wellness. Instead, the city engineered a high-density 𝗟𝗶𝗏𝗿 wellness engine. This system is designed to systematically resolve the physical inflammation that follows acute clinical procedures. Daegu's geography necessitated a shift toward recovery engineering. Because the city lacked natural advantages, it transformed post-operative care into a measurable science. The recovery process begins with a direct attack on post-operative inflammation at the cellular level. In Daegu, advanced aesthetic robotics and clinical dermatology serve as the starting points for clinical trauma. These procedures are the baseline for the recovery timeline. The integrated 𝗂𝗏 protocol couples these modern surgeries with thousand-year-old herbal pharmacology. This synthesis forces the body into a state of rapid tissue repair. By utilizing targeted herbal injections, the protocol bypasses the gastrointestinal tract for immediate absorption. This forces customized medicinal compounds directly into the bloodstream to clear metabolic waste from traumatized tissue. These biological accelerators have a measurable impact. This data shows the 𝗂𝗏 curve cutting standard recovery times by up to 40%. Chemical and cellular treatments manage the fluids and the waste, but they do not address the physical displacement of the body's mechanical scaffolding. Total recovery requires a secondary intervention to align the skeletal structure with the cellular healing already in progress. Following surgical trauma, the body enters a state of involuntary muscular guarding. This protective reflex causes pelvic shifts and fascial tension that lock the patient into a state of chronic mechanical distress. To resolve this, licensed doctors administer 𝗔𝗀. Translating to push and pull, this therapy is used to decompress the skeletal framework and restore structural mobility. 𝗔𝗀 uses calibrated body weight and drop tables. These factors map the decompression of irritated nerves across the spinal column. Practitioners use joint manipulation to correct surgical guarding, like turtleneck syndrome. Craniosacral techniques clear tension from the cranium to the sacrum, restoring circulatory flow. 𝗔𝗀 ensures the mechanical body supports its cellular repair. By aligning the skeletal framework, the body no longer exerts energy fighting its own structural imbalances. This urban medical model carries significant economic weight beyond the individual patient's recovery. By prioritizing a strictly medical track over mass leisure, Daegu has insulated its economy from the fluctuations of climate-dependent tourism. The city is capturing a dominant share of the nation's 1.4 trillion Korean won international medical patient expenditure. This closed-loop urban ecosystem ensures that high per capita yield remains within the city's recovery infrastructure, rather than leaking out to regional leisure markets. Daegu demonstrates that recovery is a calculated structural restoration. It is a system built on the engineering of healing rather than the aesthetics of relaxation. This video was created by Danny Kessler, Associate Professor and Korea's first PhD in wellness tourism.